Hi, welcome to It's Time with Chari. It's a joy to be in your home and in your mobile phones. I'm very happy to be with two very active practitioners of infectious disease, Dr. Romela Tiples Ruiz. Hi, doctor.
Good afternoon, everybody.
And also, I am with Dr. Karina Fraico. Hi, doctor.
Hello, good afternoon, everyone.
Okay, good afternoon. I have heard about this pula. Please tell me about this pula.
It's actually called Pula Negros. It's actually an HIV advocacy group. So, it started like we as infectious disease doctors actually noted that uh, we do have a lot of cases of HIV or persons living with HIV going to our clinics for treatment or for care. And we thought that, the incidence is actually rising and that we need to do something else, apart probably from just treating these patients. We need to get involved with something in the community so that others would actually know more about HIV and AIDS.
Okay, so you organize this group pula. Who are the members of pula?
We are actually a group of doctors,
Yes.
allied health professionals, med techs, nurses, okay, and concerned citizens, teachers, what else? Guidance counselors,
Yes.
okay, youth organizations actually. So it's a mixture of people who are actually concerned about the problem of HIV in the
Yes.
community.
Is this pula just in Bacolod or Negros Occidental or nationwide?
Well, it's just in Bacolod and Negros Occidental because other places would have their own HIV advocacy groups.
Okay. So when was this organized?
We are barely a month old, actually.
Okay,
Yes, yes, yes.
congratulations.
Yeah. And it's just that we feel that there is really a need for us to do something.
Yes.
We know that our government actually does some of things like testing and treatment and care, but we feel like there has to be some more community involvement
Yes.
in it, and it seems like there's a lot of us really committed and really dedicated to do something about this problem.
Yes, that is very good, Dr. Ruiz, because you have collaborated with other concerned citizens and health practitioners. I have heard that you are going to have a Memorial Day and HIV testing day on the 20th of July. Please tell us about this.
It's called actually, we have the theme and we named it actually Testing for Health, okay? Because we wanted actually not just, to have the HIV test.
Yes.
We wanted to include other tests for like blood sugar,
Yes.
okay, uric acid and cholesterol, so that we want to let people understand that, when you are actually after your health, you not just test the usual tests that we
Yes.
do, but if you are at risk, HIV test should be part of it.
Yes.
So it's actually looking at the total health actually of an individual, and for this reason also, we wanted to do it actually in SM Atrium. It's going to be in SM Atrium at 2 to 5 p.m. in the afternoon on July 20, because we want to, have an environment of a non-stigmatizing
Yes.
environment. We know that a barrier to all of these tests and treatment and care is actually stigma
Yes.
and discrimination, and that's the reason why we wanted to have, the venue
Yes.
that would actually just hope to, to have, the community, the entire community, a mixture of people in the area, so that, it doesn't really matter whether you are at risk or not,
Yes.
for as long as you consent to the HIV testing. Then, we would like actually to have that message, to all, that anybody can actually test for it.
Yes. Is it going to be free?
Yes, it is for free. It is for free. So we do have a short program.
Yes.
Okay, and we do have some invited or people living with HIV who are willing to share their testimonies,
Yes.
to share their experience. And apart from that, we are going to have the candlelight memorial.
Yes.
It's actually just a short time for us to offer some prayers for those who actually died from HIV.
Yes. This advocacy of yours and your activity on the 20th of July is actually very commendable because there are many Bacoleños who are in denial. They don't want to get tested because they are afraid that they might just turn out to be positive, or some just believe, oh, I will not have that. So, what is the importance of having this HIV testing, Dr. Fry?
Okay, it is very important for us in an early stage, and we know that we have done a lot of things or risky behaviors to have an early testing so that we will have early diagnosis at the same time early treatment and management, as well as to prevent the progression of the HIV infection to what we call the AIDS or the stage 4 disease.
What will happen if you will not get yourself tested and you actually already think that you might just have already HIV?
The problem is that if we don't get ourselves tested from an early stage or in the early time on, of course, number one, we promote the transmission of the virus to other individuals, especially our loved ones, or even to our children later on. Second, if we don't treat or diagnose early treatment diagnosis of this infection, it will there will come a time that the diagnosis is very late, and even though that the treatment is available and it's for free, it will not work that right away. Okay.
That is very important, Dr. Fraiko, that you have said the treatment is for free. So, meaning to say, you just need to get yourself tested so that you can avail of the free treatment if indeed you are already positive of HIV. We always have this misnomer, or shall I say, myth and misconception that some would say, oh, she has HIV, she is AIDS, she is a person with AIDS. Please clarify.
Okay, when we say about HIV, it refers to the virus, the ones that causes the infection. So when you say AIDS, that is already the stage 4, or what we call the AIDS stands for acquired immune deficiency syndrome. It's a constellation or a group of symptoms that an individual would manifest when he is already on the stage 4 of that infection. So it doesn't mean if you have an HIV right away you're AIDS. No, it doesn't follow. So that is why you have to screen, you have to treat early so that it will not progress into AIDS.
So, is the treatment for an HIV positive person already forever, or it could stop?
Well, for now, we know that HIV/AIDS infection is not curable. It's still manageable only. So what we are telling our patient is once you took the medications, you take it for life for now. Because even though that there are a lot of researches, but they are still at a very young stage of research. So we cannot really say that you should stop it right after 30 years or 40 years. So we have to continue for now, as long as the patient lives.
That is at least when we say there are a group of people who are willing to help and extend free testing, that is already one step towards management of their HIV. No? Okay, what about free testing on uric acid, cholesterol, and RBS? Please tell, you might have thousands of people flock to SM Atrium on July 20.
Actually, we plan to have these tests, as a package. So we deliver the counseling, and if the patient or the client consents to the testing, then the patient is actually able to have all the other tests. So it's actually a package that we want people to understand that, if you have HIV also, then you also need to try to test yourself for other illnesses. So as we gear towards, your universal health care, we have to look at the totality of a person. Okay? And HIV is one of it.
Yes.
And we want to associate it with other chronic illnesses. Okay? So just what like Dr. Fraiko actually emphasized, that it's something that you have to take treatment for life. And that's also similar to those with diabetes, those with hypertension. So it's just like any chronic disease.
the stigma should be eliminated.
Yes.
How do you think should we eliminate now that you are gathering people and having this HIV testing in public? That is already one step towards eliminating the stigma. What are the other ways to eliminate the stigma, doctor?
One of this elimination of stigma, what we also promoting our patient is that family support should be there, especially in terms of treatment, because treatment partners is very important, and at the same time, calling the support of our friends and other members of the family, for screening at the same time also, so that this was also help their patient or a member of that family which is affected with HIV to accept himself, and to eliminate the stigma by himself also.
Family support is very important. You have mentioned, Dr. Ruiz, that this is going to be a package testing, meaning to say there's no individual testing for uric acid, cholesterol, and RBS. They have got to have HIV testing in order to have the other tests. Okay, so what should they bring if they would want to avail of this testing?
Uh, well, I don't think they just nothing. They just need to be there. One of
No
the
ID, no nothing.
nothing. Yeah, yeah. Actually, the other purpose that we want also to deliver during this event is not just also for the testing, but it's actually to foster awareness. Try to empower people. At least because one of the things that we think that also feeds stigma is actually lack of knowledge.
Yes.
So we want this to be also an educational campaign, short of campaign, aside from being a testing for health.
Okay, so Dr. Fraiko, your invitation to our friends to come and have themselves tested.
Okay, so we would like to invite everybody on July 20th, around 2 o'clock to 5 p.m. at SMHAM for a free HIV screening test, and also for your cholesterol, uric acid, and your random blood sugar. So everyone will be there, so please come, and this is for free.
All right, thank you. Your message, Dr. Ruiz.
I'd like actually to invite everybody to come and just listen. Because I think you need not be probably testing. We know that it's a process of trying to understand the illness, but we would love and we would want to share all of this, information, and also the value of the test for you and your health.
Thank you very much, and congratulations for doing this. That is very good of you and your members of Pula. We are supporters of Pula.
Yeah, by the way, can I
Yes.
just add?
Yes.
We have a lot of partner organizations. There's actually more than 15 organizations that are actually bringing out, working together, okay, as Pula.
Yes.
So probably I can mention some of them. We have the JCs.
Yes.
Okay, the Filipino-Chinese Junior Chambers, the Philippine College of Physicians, the Philippine College of Chest Physicians, Canlaon Medical Society, which is a part of the PMA, Bacolod Rotary West, Guidance Counselors Association, what else? The Philippine Pediatric Society. So, and I might forget, our main sponsors of the event, which actually really did a lot of, work also with the help of their testing kits, are Bacolod City Health and the provincial health offices. Okay? Yeah, and I think I forgot the others, but there are a lot more. So it's actually something that we should, work together. We want to end this health war.
Yes, that is so true, and that's the only way we could easily stop this and is to work together, is to collaborate. And congratulations, because you are collaborating with many other groups. We are here to help you, especially the Pula members here, the Pula leaders, Dr. Fraiko and Dr. Ruiz. Please come and see them on July 20 for the free HIV screening and testing for other diseases as well. I will be back with another guest from Pula. Please stay with me here on It's Time with Sherry. Thank you. Thank you, doctor. Thank you, doc. Okay.